Hi, so I'm here for my next video today, obviously. And today I wanted to talk about my experience as an LVN. As I mentioned in my last video, I'm looking at going back to school to get my RN. I'm taking baby steps toward making that happen. Hopefully want to catch everybody up on what those plans are in the next video. I've literally just taken baby steps, but I'm making progress. But today I just wanted to talk about what my experience was like as an LVN. It's been several years since I worked, but I wanted to talk just a little bit about what my schooling was like and then what my experience working was like. I went to a hospital-based program, which means I didn't go to a college to get it. It was actually affiliated with our county hospital back in the state that we used to live in. So it was it was a tough program to get into. I had to fill out an application. I had to do an entrance exam. I had to do an interview. I had to have letters of reference. And then we were still weeded out. And I think they took 30 and we graduated with 10. So it was a tough program. I actually, in digging through all of my paperwork to apply to programs up here or to apply to colleges up here, actually found my report cards. And basically the curriculum is the same. We had Med-Surg 1, Med-Surg 2, OB, pharmacology, community health, all those kinds of things, just like you do. I guess in an RN program, it's just in a condensed setting, and it was over 12 months. We did most of our clinicals. I believe we started our clinicals after 3 weeks, and that was tough. It was, we were in clinicals for 6 hours a day. The first part of the semester we were in for 2 days a week and then had post-conference. And then the last part of the year, the last 2 semesters, we were in 3 days a week. And we rotated everywhere. Predominantly the hospital, since that's who we were affiliated with, but we rotated out to other hospitals. But being affiliated with the county hospital meant we saw everything. We rotated into psych, into the psych ER, into the regular ER, the operating room. I got to witness a lobectomy, and I got to stand and look down into an open chest and watch a beating heart. And when the lobe came out, they passed it off to me, and I transferred it over to the table and got to manipulate this cancerous lobe and talk to the surgeon and communicate about how, the effects of smoking and the effects of the way this cancer had grown and metastasized, and it was such an awesome experience. We did home health, we did pediatrics, OB, obviously, wound care. We actually did 2-day rotation in the county jail, 1 day in intake, 1 day actually in general population, in the infirmary. It's been so long, I can't even remember, but all the general rotations that you would imagine, and then went to, like I said, into other hospitals. We did hospice, ICU. So we actually did more clinical hours in our 1-year program than a competing, very prestigious private school BSN program did in their 2 years in their nursing program. We had more clinical hours in our 1 year than they did after their 2 years and graduated with the BSN. That's not to knock BSN programs at all. I'm trying to, to get my RN. It's just we came from a very strict program and came out, like I said, ready to work. So I went to work the last place I ever thought that I would go to, and that was at the county hospital. Like I said, I went to school there and thought, I'm never going to go to work here. This is the county hospital. I'm not going to go to work here. I want to go to work at one of the nice hospitals, one of the, fancy new hospitals, or I'm going to go to work at a doctor's office and have a 9-to-5 job and have a life. And what did I do? I ended up at the county hospital working the night shift, which is exactly what I wanted. I was one of the first ones in my class to apply and get offered a job, and I had first choice of shift, and they assumed that I would want day shift, and there was a night shift opening, and I'm like, nope, I want to work nights. I've always been kind of a night person, and there's a shift differential, and just something about the idea of working nights appealed to me more, and I absolutely loved it. My dogs. Never going to escape my dogs on this channel. So I worked antepartum, which means I worked with the high-risk OB patients. Most of my patients, probably about half of my patients, were pregnant, were in for pregnancy-related complications like preterm labor, pregnancy-induced hypertension, other pregnancy complications, placenta previa. But we also had Gyn, post-op patients, hysterectomy, things like that, Gyn Oncology. We also had the perinatal loss patients, and just kind of a general mix, but it was all women. It was women's services. And then I was trained to float to newborn nursery, postpartum, and NICU. I did very little time in those, but because our floor was so understaffed that I rarely left my floor, especially the night shift. We honestly only had 2 full-time night nurses for my unit, and both of us were LVNs. Everybody else was afloat. And so I trained pretty much any nurse or any float that came through our department that was a true float or a travel nurse or a PRN nurse or whatever, even if they were RNs, I was the one who trained them. In STs, because it's a whole different world when you are taking care of a pregnant patient, because not only are you caring for that patient, you're caring for the baby inside. So trying to do fetal heart tones and STs, all that stuff means you're really taking care of 2. When you have 7 patients and 4 of them are pregnant, you're kind of doubling those 4. So it's a whole new world, and it's kind of a scary world. And I truly gained the respect and the trust of most of the doctors, all of the doctors, but there were we dealt with residents primarily because we were a teaching hospital, so the second-year residents are who we dealt with the most. So our second-year residents would come through and would see me that I was on the floor and would be like, do you have my patient? Can you please double check this NST? So that was a good feeling. So I worked there night shift for a few years and absolutely loved it. Working night shift is a whole different ball game. You really become family when you work night shift. We only ever had 2 nurses on our unit. We rarely had techs. We rarely had CNAs. So we were responsible for everything. And I know that in a lot of places, LVNs don't get all the respect and all of the glamorous jobs and everything. My experience was very different. I came from a hospital that treated LVNs very well. Times were different. I know that with the statuses of magnet status and all the stuff with hospitals now, they're really pushing for most nurses to be, got a kid, to be RNs, not just RNs, but BSNs. So things would probably be different now. You need to watch out, babe. Okay, what? I'm talking. Sorry. Always going to be somebody interrupting. And that's great. And that's why even at this stage, I'm trying to, get back in school and get that. But back when I was working, there was hardly anything that I couldn't do. I literally could not, if I had a patient getting a blood transfusion, I could pre-medicate the patient. I could check off the blood. I could monitor the patient throughout the transfusion. I could do everything except literally take the bag of blood and spike the bag with the IV tubing. An RN had to come in the room and do that. Other than that, everything else I could do. It was literally taking the bag, spiking the bag. That 2 second worth of work took somebody with a whole separate set of initials after their name. And if I remember right, I don't think I might not have been able to draw blood off a central line, but don't quote me on that. And that was about it. I mean, I started IVs, pushed IV meds. I admitted patients. I discharged patients. A lot of the things that in some hospitals or in some states, LVNs can't do, we did. We were trained to do. And like I said, every state's different. But I had a great experience and got a ton of education and experience under my belt and got to do a lot of things, saw a lot of things. I mean, I could do a whole other video on just the crazy, wild things. I've been involved in codes, had patients pass, literally had to ride stretchers into the OR because of a cord prolapse. Had patients bleed out due to a placenta previa with a placental abruption. Patients deliver in bedside commode or start to deliver. So, wild and crazy world at the county hospital. So, that was my experience as an LVN. At this stage, as I said in the last video, my license is basically inactive in good standing, basically retired. So I know that what I'm allowed to do as an LVN is different in the state that I'm currently in. So I'm not looking to get back into that. One of the programs that I'm looking into, one of the BSN programs that I'm looking into allows you to sit for the LPN, and after the first semester of nursing classes, I believe, and at that point you can exit the program and stick just with your LPN. I wouldn't want to do that. I could probably look into doing refresher courses or something. I don't even know what it would take at this point to get my LVN or LPN license back. I'm not interested. I don't want to be an LPN or LVN anymore. I mean, if I could do that to try to help me leapfrog ahead into an RN program, that'd be great. But at this point, it's going to take me just as long. So why not just go? And I don't feel like I remember enough. Like, I know I need to repeat anatomy and physiology. I know I need to repeat micro and all those things. So I may as well just start at the beginning. So, but all of this to say, my experience as an LVN was a really good experience. I feel like I gained a lot. I'm glad that I did it. I'm glad that I worked where I worked. I'm glad that I got the training that I did, and I have no regrets. And I think that experience is what makes me miss nursing so much and why I'm so ready to move forward. And even at this late stage of the game, and why I'm ready to get back to it. and kind of start over, do all this again, because I miss medicine desperately. So anyway, I have another video that I'm gonna be making soon that's gonna update you on what I've been doing to pursue the next phase in this little journey. So I'll be making that shortly and keep everybody updated. So thanks for watching. Bye.